All right. Hi, everyone. A couple more people are joining in the waiting room, so I'm just going to let them in and then we'll get our lecture going. Thank you all for joining. I hope everyone can hear me okay. Let me know if anyone has any audio or video issues. I'm Sophie Block. It's so nice to see you all. I'm the director of Hillels of Memphis, which serves University of Memphis and Rhodes, as well as the other wonderful academic institutions here in Memphis. And I'm really excited to introduce this series to you. If this is your first time, welcome back. If you've been to other lectures in the series. On One Foot, which is this series, is a series that features different Jewish faculty members from Rhodes and University of Memphis every other week to spotlight the incredible Jewish intellectual talent we have here in Memphis for the entire Jewish community and Memphis community to enjoy. Each guest speaker is encouraged to discuss what their academic area of expertise can teach us about navigating life's challenges today, as well as share their own Jewish journey. Today's lecturer is Professor Marian Levy. Dr. Levy is a professor and associate dean of the School of Public Health at the University of Memphis. She received her doctorate in public health from UCLA, a registered dietitian and fellow of the Academy of Nutrition and Dietetics. Did I say that right?
Yes.
Okay. I don't think I've said that word before.
Yes.
She's spearheaded numerous initiatives to promote health and equity, provide environmental support for healthy lifestyles, and enhance eco-responsibility. So thank you so much, Dr. Levy, for being our guest speaker today. And with that, I will officially pass you the mic and let you take it away.
Thank you, Sophie. Thank you so much. It's so good to see everybody. Hey, Richard, where's Susan?
She's on Zoom with Temple.
Okay. Well, it's nice to see everybody, and thank you for sharing some time today to talk about the School of Public Health and some information that we can share. I'm going to share my screen right now. Let's see if I can get, okay. To begin with, let me tell you, look, for those of you who don't know me, I know several people on the call, but I'm Marian Levy. I am a native Memphian, and I think I'm best known as Joe Levy's sister. Joe and I, to talk about our background and why we went into, for my situation, public health, and for Joe's medicine. We grew up in Memphis. Our parents were Holocaust survivors. They escaped Germany in December 1938. So we have always felt a need to make a difference, to do something valuable for the community and for our people and for all people. And also to protect the vulnerable people, to give people a voice whose voice is not heard, because of things can change very quickly, and it's important to protect people and make sure that everyone is safe and lives well. So that's a little bit about the reason I went into public health, and I will share my screen. This is a little bit about the School of Public Health. We are an academic health department at the University of Memphis. We work with the Shelby County Health Department, and we work also with the West Tennessee Regional Health Department. So we have academic health departments. Our students do internships there. We do collaborative research with administrators and people at the health departments, and they guest lecture in our classes, so that our School of Public Health really teaches our students about public health practice and how to conduct research. I was telling Sophie before we joined the call that we've had about a 50% increase in people who've wanted to come to the School of Public Health in applications. So we're growing. As you can see here, we're a CEF accredited School of Public Health. It's a national accreditation by the Council on Education for Public Health. And we just had a renewal. So we're renewed for 7 more years. So we're excited about that. And principles about public health that we share with our students and that are priorities for us are health equity, making sure that everyone has equal access and equal types of care, the best care that we can provide for all. and social justice. So our public health values are, in terms of social justice, that all people should receive equal access to services regardless of who they are, where they live, and what they do. That everyone should have the benefits and responsibilities of freedom and the services that we enjoy. And with public health, we focus on populations, whereas a clinician or physician might focus on individuals. We focus on cities, communities, neighborhoods, states, nations, internationally. Excuse me while I get some water. So we want to make as large an impact as we can. And with the global pandemic, that's what we're geared to do, to protect individuals, protect communities, and make sure that the virus is contained. We also focus on prevention, whereas a clinician is going to cure disease or take care of a patient's individual illness. Our goal is to prevent things from happening. So we look at obesity in terms of let's make sure everyone has access to healthy foods and eats healthy foods and has access to safe neighborhoods where we can walk and be healthy. So we focus on primary prevention. And can anybody think of how this plays out with COVID-19? How we're trying to prevent the spread? Anybody have any ideas? Feel free to jump in.
I bet it has to do with masks.
Yes. We urge people who are not sick and who want to avoid being sick to wear masks. There's something called secondary prevention, which is identifying disease early on before it gets to be huge. And that would be like testing, COVID-19 testing. But we primarily, public health looks at how can we prevent disease in the first place. This is something, I hope we can have a dialogue about this. One of the big controversies and concerns of public health and issues in public health is individual liberty versus collective well-being. There's a story by Garrett Harding called Tragedy of the Commons. It's a story where a lot of herders have their cattle on very fertile land, and they bring their cattle and they say, well, this is a nice place, and they bring more cattle, and eventually the grass is depleted. It's only soil there. No one has any benefit from it at all. So it's a story that it's important to have individual rights, but in order to have collective well-being, sometimes you have to restrict rights. So does anybody want to comment on this?
You've got everybody on mute, so you can't really.
Oh, undo everybody then. Can you?
Oh, she must have.
Hi, Flora. How are you?
She heard you.
Does everyone know how to unmute themselves if you want to join in the bottom left?
Here's his shit. This is unmute.
Anybody have any thoughts about weighing individual rights versus the rights of the community?
So I'm Cynthia Bernstein, and I'm living in Florida now, and it's become a huge issue here in watching the neighborhood computer organization and people protesting against having to wear masks. And they see it, I think, not as, they just see it as an individual liberty issue. They don't see it as contributing to the collective well-being that they wear a mask. They just think it's my right to wear a mask or not to wear a mask. And I don't think they're persuaded that it contributes to the collective well-being if they wear a mask. And I don't know how you address that. That would be something I'd like to be able to respond to without creating this contentiousness.
Well, I think We can also look at it as individual responsibility and collective responsibility, that we have a responsibility as an individual to take care of ourselves so that we don't get sick. And I have an individual responsibility to protect other people so that they don't get the disease. Anybody have any thoughts about that?
I imagine it's sort of a vicious cycle, and that the more it's sort of this a self-fulfilling prophecy, the more we focus on ourselves, the harder it is to feel connected to the collective, and it just sort of reinforces this sense of self-focus or self-centeredness.
Yeah, and I've seen some marketing marketing messages that say, I do it for myself and I do it for my mother, or I do it for my sister, So I think if people can shift it in terms, we do have the individual liberty. We don't have to, we want to go out. If we all contribute to the collective well-being, then it will pass more quickly. The flip side is when, and I'm not talking about COVID-19 now, but if you look at the issue of gun control, that people, I can understand that people want to limit gun violence. From my background, though, if there is a situation where there is a tyrannical leader or some situation where you need to defend yourself, I can see the need to have the Second Amendment. So it's very interesting in public health. I think the sign of an intelligent person is they can hold two opposing thoughts in their mind at the same time. But it's an interesting discussion. What do y'all think?
Hi, this is Elisa Taub. I was following a discussion the other day where there was, when you were talking about gun rights, it sparked this thought about, the conflict between the First Amendment's right to free speech and the Second Amendment's right to carry. And I think that just like with mask mandates in the COVID context is the direct, you have two individual liberties in conflict with each other, but you also sort of have this collective well-being idea, because if somebody is monitoring a polling place with a gun in their hand and I'm going in to exercise my right to vote, or I'm holding a sign for a political candidate outside, then there's more of a collective threat potentially from somebody exercising their Second Amendment right to carry. And so it was a very interesting discussion there, because you're almost you're sort of making value judgments about what rights are most important, and do individual rights trump all? I can do anything that I want, and it doesn't matter how it affects anybody else, because I'm the most important person that there is.
You bring up a very good point. There are 2 points of views. There's John Stuart Mill, who's a libertarian, and he has a very interesting point of view. He says, I can do whatever I want until it affects someone else. For example, he gives the example of alcohol. I can drink whatever, I should be allowed to drink whatever I want. But when I get into a car and I run the risk of hurting somebody else, then you can restrict my rights. Then you can say you can't drink, you can't enter a car, drive a car drunk. But he says, if you see, I'm also a registered dietitian. So the next example I'm going to give is interesting. I think it was Bloomberg in New York wanted to limit the size of sodas. So you don't have a big gulp, you don't have 96 ounces. As a registered dietitian, I'm saying that's good. Yeah, but people have the right to eat and drink whatever they want, as long as, we don't want to be a nanny state. We don't want to cross the line. But then you think on the other side, well, if people are overweight and it puts a stress on, they're increasing diabetes, increasing cardiovascular disease, then it becomes a national health burden, an economic burden on the nation. So what do y'all think about that?
She's right. Hard to get responses.
And there's no right or wrong answers, but it's important to think about the ramifications of the different points of view.
This might be tangentially related to that, but I wonder how much of this has to do with how tangible the threat is, and that a disease like COVID or a virus like COVID is something that we can't point to necessarily, or we can't kind of see and feel the way we can identify a physical gun.
Right.
That makes sense.
Yeah. And a gun has immediate impact. I mean, a gun is very violent. And it can be the mass deaths can be prevented from a deranged gunman. But then you can also think too, if people wear their masks, it's going to stop the spreading. It's just, and it gets back to Hillel. If I'm for myself, if I'm not for myself, who will be for me? If I'm for myself only, what am I? And if not now, when?
Good.
Last shot, that's I.
Hey, Harry.
I'm glad you think it's funny.
I have my phone on. Siri said, I'm glad to think it's funny. Okay.
She heard you on herself.
I don't know. Keep this in the other one.
Gary's chiming in.
Siri's listening. So. But any other thoughts? Because these are interesting, they're academic issues, but they're also immediate issues related to our society. And then you can think too about people who don't want to immunize their children and get, measles, mumps, and rubella vaccines. So, and I think Sophie said something interesting about how tangible something is. People who are not familiar with polio, I grew up polio, we were lucky to have the Salk vaccine in the 50s. But if you've never had experience with polio, you don't see polio as a threat. You don't see measles as a threat. And it's interesting, there's a researcher, Dr. Schaefer at Vanderbilt, did a study, looked at attitudes of people for immunizations in the Nashville area. And who do you think was more likely to say, yes, we need to get immunizations, measles, mumps, and rubella? Which group of people do you think?
Jewish. I think so too.
Well educated.
Oh,
You would think the well-educated, because we know. But he found that the recent immigrants, refugees, were more likely to say, yes, we need, because they have experience, they have seen smallpox, they have seen polio, they have seen these diseases, and they know the reality of it. Sometimes highly educated people are the ones who say, well, we want, I don't want to make value judgments about anti-vax, but in our profession, we know the value of vaccinations. We know the value of immunizations. Some people don't see that value, but it's interesting what I'm bringing up with Sophie had said, if you don't see it as a threat, then it doesn't really matter. But if you know the ramifications of it, if you know somebody who's had COVID, or if you're over 60 and you're at high risk, then you're going to take precautions to take it very seriously. So, okay, I'll move on. I just want to share with you some of the exciting work we're doing at School of Public Health with the community. Our students are doing case investigation and contact tracing with the health department. Our strategy, Vicki Nolan and myself are working with the health department to evaluate the set the mitigation or containment strategy that the health department is using. In other words, how effective is their mask ordinance and how effective are their initiatives to contain COVID-19. So we're doing a facial mask compliance study, some of our students and Vicki and myself. And we're also part of a national study of mask adherence and distancing out of California, out of Kaiser Permanente, sponsored by the National Health, Lung and Blood Institute. So that's exciting too. So when our students do case investigation with the health department, they do contact tracing. And the skills that they need, you know, they're trained. There's a training procedure for it. They're trained in terms of confidentiality, cultural sensitivity. We call it cultural humility, that no culture is better than anyone else's. We take people for who they are. There's a great icon in public health called Paulo Freire. He says, start where the people are, understand the people, understand their perspectives and where they come from, and respect who they are. Then they're taught interviewing skills. So they do the contact tracing. And this is important too, the cultural sensitivity, so that people feel comfortable with you, so that they know they will share with you who they've been in contact with, and you can do follow-up. So what we're also doing with the Mayor's COVID-19 Joint Task Force, we're looking at the compliance with social distancing, the Safer at Home ordinance, and the mask rule regulation. And we're looking at the facial mask compliance. So we have several ways to do it. We have a nice working relationship with the Memphis Police Department. So we have access to their videos, and we observe, they give us the videotapes on Madison, Highland, and Beale Street. So our students are able to look at the videos and assess how many people are wearing masks and how many are not. We're also doing the live observations. The health department gave us 20 different locations throughout Shelby County. 10 are of high transmission areas and 10 are low transmission areas in those zip codes. So we're looking at the relative difference of mask usage in people who are at high risk and people who are at low risk. And then there was an online survey, and we're comparing our work with nationally with the Kaiser Permanente group. So this is just showing you the video surveillance methodology and the observational audits. Our students enter the data on their cell phones, and of course they're wearing masks, and they're they keep a safe distance. We want to ensure that our students are safe as they're doing this. So this is the results of what we found on June 15th through 21st, before the mask ordinance, the city mask ordinance, and the county health initiative. 51% of the 4,000 people in those 20 locations, 51% were wearing masks. Then after the ordinance, it jumped up to 92% in July. And this was right after, we were very lucky. We said to the health department, let's examine how many people are wearing masks. We didn't realize there was going to be an ordinance, and so we could compare pre and post. So, and then in August, it's up to 96% compliance. September, 95%. And in October, I don't have the results on the screen, but it's around 90%. So we're finding that people in these 20 locations are adhering to the mask ordinance. And these are big stores, big retail outlets. And here's results of the video observations. And I'll just share with you Beale Street. July 5th, which is, because remember, June 25th is when the ordinance came into effect. So July 5th, there were 81 pedestrians, 27% of them wore masks. In September, 178, 35% wore masks. Recently in October 10th, 485 pedestrians and 46% wore masks. So looking at this, what do you see? What are some insights that you can share?
Moving, but it's not enough.
I'm sorry?
I said it's improving, but there's not enough participants still.
Right. So we saw the 90% in the retail areas. And I'm thinking that's because at Lowe's, Home Depot, they have signs up. You got to wear a mask. At the grocery stores, you got to wear a mask before you go in. These are people on the street. So what else do you see? In addition to the fact that, it's increasing 27, 35, 46, it's still not good. But what else do you see from these numbers?
It looks like the same number of people are wearing masks and the same number of people that don't wear masks are the same ones. Because if you do the percentages with the numbers show that basically they're all, the same people that were wearing masks are still wearing masks, and the people that weren't aren't.
Well, what else do you see? Look at the numbers. I'll give you a clue. Look at the numbers.
See more people out.
See more people out. So that's, in my opinion, that's why if the COVID-19 rates are increasing, it's not because people they're adhering to the mask ordinance in the large stores. But when they're in social situations, when they're in Beale Street, they're out in public, there's a lot of work to be done. And the numbers are growing because this was after the shutdown. This is after the 4th of July, right after June 25th. And people are getting out more. And the percentage is increasing, but the volume, this is almost over 5 times what it was in July.
Okay.
So we could talk a little bit more, but I wanted to thank the Shelby County Health Department, the Mayor's COVID-19 Joint Task Force, the Police Department, and our Master Public Health students for collecting the data and providing this information. But happy to share anything that you would like to discuss or ask.
One of the things is you really can't compare the outside with the stores and restaurants and whatever, where you go inside, you are required to wear the mask, and the people will escort you out if you're not. So, I mean, that's a big difference.
Yeah. So the good news is we do have compliance among the store owners, the companies. They are complying. And it could be because they're inspected by the health department. They know the health department, they have to answer to, they're not, well, I think the health department certainly can't close them, but they can say, you're not complying with the mayor's policy. But
Yeah,
go ahead.
That's been one of my questions this whole time, is how this is necessarily being enforced, because I haven't witnessed any enforcement of this, which maybe implies that people are complying, but I'm curious what that would look like and how the enforcement is coming into play.
Well, the mask ordinance states that there are no financial ramifications or no, there really aren't, there aren't any things that you can put someone in jail or, it's not enforced to that aspect of it. So it's mainly encouragement and I think too, with stores, with restaurants, there are regulations now that you can only have 30% of people in a restaurant. There are regulations that can be enforced with companies, but out in public, and this is what we're going to face too as we approach the holidays, as we approach Thanksgiving and Christmas and Hanukkah. When families get together, we have to make sure that the younger people understand that they can be exposing the older people to it. If a younger person gets COVID-19, they're going to recover, unless, they have other underlying health conditions. But a child or a young adult, they're not going to have the effects that a person over 60 will. So, and also we're finding too, we looked at the age grade, there's a gradient when we do these mask observations, and there's a gradient. The highest number of people, highest percentage of people who wear masks are the older people. So there's a clear gradient between the young and the old. So the people in their 20s and 30s are the ones who really need to get the message that what they're protecting the community. They're protecting themselves as well, but it's not that critical, because if they get sick, it's just going to be flu-like conditions. It's not going to be, for the most part, serious. But and I really applaud Temple. I don't know about the other synagogues, but Temple had the remote High Holy Day services, which was a blessing, which was very much appreciated, very important, especially for people my age. So that the people who have to be protected are the ones who are at highest risk. And if younger people interact with it and are asymptomatic, which they're going to be, if they're asymptomatic and they interact and they transmit it to older people, then it's very serious.
I imagine a big part of it is also some social accountability too, that we need to be, as a culture, as a society, keeping ourselves accountable to still wearing masks, still social distancing. I think before everyone else got on the call, you had mentioned fatigue, like pandemic fatigue, that it's just become almost normalized now. So it's easy to let your guard down.
Right, right. And I think people are tired of it. They want to get back. They want to get back onto campus. They want to see their friends. They want to go out, and they just have to do it safely. I see Rachel Tannenbaum. Hi, Rachel.
Hi.
How are you?
Good. How are you?
Good. Anybody else have any thoughts?
Any thoughts or even any questions you'd like to ask?
You know, I was thinking about the age difference. If you look at other things, not the COVID or the pandemic or anything like that, the younger people have a mentality like, I'm going to live forever, so none of this bothers me. And I think that just carries over into the pandemic, and it looks worse now because we're more visual to it than we were before.
I think you're right, Richard. I think younger people have a sense of invincibility, and we were like that too, when we were younger.
Yeah, exactly.
Yeah. And then it gets to the point of our communities telling our younger people that they have a sense of social accountability, that they may not get sick, but when they interact with their grandparents or older people in the community, that they have, and again, it's the sense of the protecting the community that we're talking about, the collective well-being. And it has to be framed. And Rachel, you're in your 20s, I guess. You're a young person. I don't want to put you on the spot, but what do you think would resonate? How do we approach young people to help them understand the importance of wearing masks, the importance of collective responsibility?
Yeah, well, I think it's really difficult because, I'm learning a lot about it through public health school and the importance of it, but I have a younger brother that is in college, and he's in a fraternity, and he has the invincible sense, like, I'm going to be fine. Like, he already had COVID, so he's like, I'm immune forever. And so I just kind of like see how people are thinking like, I'm okay, but there's been a few cases of kids on college campuses that like have an underlying condition and then end up hospitalized. So I think like it's going to take cases like that where people, because I think people don't get the point until they're individually impacted by it. So there's going to be more and more people that have like someone that they know that has gotten really sick from it. And I think that might be the like wake up call for a lot of kids. I think it's hard just to explain the importance of it without them having any example in their life.
Yeah, yeah.
'Cause it's hard. I mean, that, like, if I were in college or in high school, it'd be really hard to be isolated and not socialize, and it would impact your development. So I don't know. I think it's a difficult question.
And I think, who was from Florida? Was it Phyllis?
That was
That-
Professor Bernstein.
Cindy, I'm from Florida. I'm having to get up and down with my dog.
okay.
So, yeah, I did have a question. It's tangential to this. It had to do with the percent of positive tests that are recorded and the significance of that to the danger of a state. So we look at that as though if a high percentage being tested are positive, we think the state is in more danger than if it's a lower percent. I'm wondering what that really means, the percentage of people who are being tested, and whether it's more a factor of who's going in for testing than it is how much danger the state or the community is in. So I'm going to put myself on mute again for the
function of the denominator. How many people are getting tested? So if you're doing a good job and a lot of people, if you have the supplies and the equipment where you can test a lot of people, at the beginning, the supplies were very sparse, very scarce and sparse. And we had to test the people who really had the symptoms. And then it's, okay, we have enough equipment now, we can test everybody. It's a matter of how many people are going to get tested, how many people are exposed, and how many people are think that they, you know, have COVID-19. But it's to me, it's a function of the denominator, how many people are getting tested, you know.
So I'm just thinking it's not just the number in the denominator, but the population in the denominator. In other words, are they, if it's all like randomly tested, or all of the nursing home being tested because, and so on, that's one thing. But but we don't really have that information in general when that information is reported as a statistic.
That's a good point. Very good point. The reason I mentioned you because we were talking about the young people. I remember in Florida during spring break, I think a lot, and actually the outbreak not the outbreak, but the COVID came to Memphis because of Mardi Gras. There were 5 or 6 people who went to Mardi Gras and came back, you know, returned home to Memphis. And so that, you know, it's just the problem with viruses like this is you're asymptomatic and you're contagious before you realize you have symptoms. So
I have a question. So before everyone joined, we were talking a little bit about what it's like for public health students to be we're all living through a historic moment, and the people that study public health are studying it in real time. And so can you speak to that a little bit and what it's like to be in this historic experience?
As a faculty member, it's very exciting because you can talk about these issues, and you can talk about, because I work with the health department on the H1N1 plan. You know, I was a consultant, and that was very theoretical, and that's nice, but to see this in action, it's something that someone else brought up. I think you brought it up, Sophie. It's very tangible. You can see it, and it's historic, and it's putting the principles of public health in action and putting our profession in the spotlight. Because of HIPAA, I can't say anything about any students, but if there are any students who want to mention anything, that's fine.
Yeah, I'll talk from the perspective of a public health student. Sorry, I'm getting a call. Well, I think it's interesting because if you weren't in this time, you would learn about health disparities and social determinants of health and all the things that you're learning about. And you can learn about it. And a lot of times you learn about like marginalized groups that may or may not relate to who you are. But now every single thing that we learn about, you can think about it in the context of like what's going on now and who it affects. Like when even like in class, we're learning about collective versus individualized like rights and how the world should work and how it does work and perspectives. You kind of learn about it, like you can narrow it down to exactly what's going on today in politics and like mask adherence. So I think it kind of like makes it gives what you learn a sense of urgency, kind of like it's not just like a topic that you're learning about anymore. It's like you think about it and you're like, whoa, this is what's happening in the world right now too. So it makes it even more like come to life, and it gives me more of a sense of like, wow, this is a really important like field to be in. Whereas if I had been taking this degree at a different time, it probably would have been like, oh, this is interesting, but learning it now is like, whoa, this is so important.
Yeah.
Thank you. Yeah, even as a non-public health professional, I try to remind myself when things feel overwhelming or it feels so out of control that this is, as difficult as this is for so many people, we are living through a historic time, and that's not an opportunity that every human being ever has,
Right.
or always has. So try to give myself that sense of perspective.
And I think, let me ask a question, because I have some ideas, but does anybody have any ideas or any perspectives on some positive things that have come out of living in this pandemic?
We get calls when we need something from the grocery. People are very supportive.
Yeah. Anybody else?
I think we're using technology in new ways.
That's true.
I think it makes you like think about like what's really important to you and like who's really important to you. It kind of forces you, like a lot of the distractions that you usually have go away. So you kind of have to like focus on the things that really, really matter to you in your life.
Yeah, and that's what it's done for me too, because a lot of the distractions, like driving here, buying clothes, you know, it comes down to the relationships and the health of the people who, you know, who are close to you and who you care about, and the relationships that you have, and the importance of health.
I'm loving the things we can do by Zoom. So in a few minutes, my husband has a Zoom checkup on his computer, but also this kind of a meeting that we would not all be together learning and talking this way. And I've had a couple of family occasions, one bar mitzvah where people from all over, and also they have family in Italy, everybody came on Zoom to this bar mitzvah that was performed in a temple, but we all attended by the internet, and also a family member's 100th birthday party where many people got together that might not have been able to come together via Zoom. So in some ways it's brought some family and occasions closer to us. But I wish we could visit in person.
Yes, that's lovely though, that it's nice that you can, the technology, I think Rachel said, the technology has improved so much that I attended a conference, American Public Health Association conference. I didn't have to go to, if they didn't have it in San Francisco, it was all virtual, but saved a lot of money, a lot of time, a lot of hotel expenses. Of course, then you look at the economic downside, then the hotel industry suffers, and the plane, you know, the airplane industry suffers. So it's, there are a lot of benefit. I think it gives us a lot of things to think about priorities.
Along those lines, I feel like I'm always sort of germophobic myself, but I feel like in general, we're probably more aware of how we sneeze, how much or how little we're washing our hands. So I feel like, and I'm curious if you've noticed those changes happening, how our awareness about health is impacting the way other illnesses are spreading or not now.
Yeah, it's a good point.
Yeah.
A question. When there is a vaccine, do you think that people will relatively quickly return to their normal activities, or do you think the longer this goes on, the more hesitant they might be to get back to their usual activities?
That's a very good question. And at the American Public Health Association, the executive director, you know, we asked him about vaccine, and he said, you know, it may seem like we're doing it very quickly, but but they have been researching vaccines for about 15 years with SARS and with other other viruses of this nature. So it's not that they just picked it up. And so there's been a 15-year history. The compression of it is the testing and ramping up of supplies. So I see hesitancy for political reasons that some people may not think the vaccine is safe. But once the vaccine, if the FDA says it's safe and effective, then I'll be taking it. So I think the vaccine will help people have an immunity to it, and we can go back to the way our society, back the way it has been, because this health threat will have been reduced. For people who don't take it, then they're still going to be vulnerable, but there'll be less people spreading it. It will be more or less contained. So that'll, when the vaccine comes out, that'll be a big benefit. That's a good question.
Any other questions or comments that we haven't touched upon? I feel like we've unearthed so much just in the last 48 minutes.
And an interesting program.
It's a great thank you, Sophie, for having this dialogue, because it's
of course
a chance to exchange ideas and learn new perspectives and share some thoughts.
Of course. Thank you so much for taking time out of your busy schedule. I know you're experiencing all of this in real time, personally and professionally as well. So it's been such a pleasure to learn from you. Thank you everyone for signing on. I'll give a quick shout out about the next lecture in our lecture series, which is 2 weeks from today, Friday, November 13th, with Professor Kate Shafson, who's the Dean of the U of M School of Law. So she'll be talking about 5 reasons to go to law school now. So different perspective on the same sort of situation we're all in. So I hope to see some of you there. And otherwise, have a great rest of your day and early Shabbat Shalom to all of you. And I'll see you soon.
Thank you. Thanks, everybody.
Shabbat Shalom.
Bye.
Hey, Marshall.